This study, this research paper, is called Musculoskeletal Complaints, Physical Activity, and Health-Related Quality of Life Among Patients with EDS Syndrome Hypermobile Type. This is an older article. It's from 2010 from the Journal of Disability and Rehabilitation, but this is what I would call a landmark study in EDS. Because I'm about to do an EDS study with abdominal strengthening, I always go back and reread and see if something strikes me differently. I mean, of course, a normal PT who is in clinic about to treat patients is reading a journal article on a whole body vibration plate. Woo! You know, just a use. So I'm gonna do my whole body vibration. And I'm reading a joint. Is generalized severe joint hypermobility is a dominant clinical manifestation which is frequently associated with joint dislocations and chronic pain. Yeah, that pretty much sums EDS up in a nutshell for when I just treat my patients. So they cite an article by Stansky et al. Pointed out that hypermobility EDS is the most debilitating form with respect to the musculoskeletal function. Keep in mind, that form is underdiagnosed because there is not gene testing for it. Furthermore, the importance of physical activity with respect to health-related quality of life has been well documented in this particular study. To our knowledge, no studies have yet investigated physical activity in EDS patients. Now, this article is from 2010, but it's a good one. And I'm about to do a research study on EDS and abdominal strengthening. So I'm rereading all the good things. More than 90% of EDS hypermobile type patients are female, 90%. The current study included only women, 32 females diagnosed with EDS with a median age of 38, so pre-perimenopause. Remember, a score of 5 out of 9 indicates generalized joint hypermobility. So some open-ended questions that people could ask a patient who has EDS would be, question 1, which are your musculoskeletal complaints? Are your musculoskeletal complaints related to EDS hypermobile type? Question number 2, which of these complaints do you perceive as the most severe? Number 3, what is your most frequent musculoskeletal complaint considered to be related to EDS? I absolutely ask this to all my patients because they will come in with 7 things wrong, and I need to know what bothers them most because that's what I want to help them fix. Regarding the frequency and seriousness of complaints, joint pain was reported by 66.7% of the EDS hypermobile type patients. 29.6% complained of joint dislocations. The median pain intensity score was 4 out of 10. It seemed reasonable that problems with musculoskeletal symptoms, including pain, joint locations, muscle cramps, tendonitis, headache, and fatigue, all have a considerable impact on a reduced physical activity and quality of life in patients with EDS hypermobile type. However, the small study population and design of this study limited the analysis of drawing conclusions of that.